Hi, my name is Elizabeth Moore, and I'm a nursing student from Indiana State University, and this is my presentation on depression. Population at risk. Everybody is at risk for depression. In 2019, 2.8% of adults experienced severe symptoms of depression, 4.2% experienced moderate symptoms, and 11.5% experienced mild symptoms. The percentage of adults who experienced any symptoms of depression was highest among those aged 18 to 29, followed by those aged 45 to 64 and 65 and over, and lastly, by those aged 30 to 44. Women were more likely than men to experience mild, moderate, or severe symptoms of depression. Non-Hispanic Asian adults were the least likely to experience mild, moderate, or severe symptoms of depression compared with Hispanic, non-Hispanic white, and non-Hispanic Black adults. Objectives. After the presentation, you will be able to describe depression, identify the signs and symptoms of depression, identify the causes of depression, list the risk factors associated with depression, identify the complications of depression, describe how depression is diagnosed, and describe the most common treatments for depression. Please pause now and take the attached pretest. What is depression? Depression is a mood disorder that causes a persistent feeling of sadness and a loss of interest in usual activities. Also called major depressive disorder or clinical depression, depression affects how you feel, think, and behave and can lead to a variety of emotional and physical problems. Individuals may have trouble doing normal day-to-day activities and sometimes may feel as if life is not worth living. Causes. It is not known exactly what causes depression. As with many mental disorders, a variety of factors may be involved, such as biological differences. People with depression appear to have physical changes in their brains. Brain chemistry. Neurotransmitters are naturally occurring brain chemicals that likely play a role in depression. Hormones. Changes in the body's balance of hormones may be involved in causing or triggering depression. Inherited traits. Depression is more common in people whose blood relatives also have this condition. Symptoms. Although depression may occur only once during your life, people typically have multiple episodes. During these episodes, symptoms occur most of the day, nearly every day, and may include feelings of sadness, angry outbursts, loss of interest or pleasure in most or all normal activities, sleep disturbances, including insomnia or sleeping too much, tiredness and lack of energy, reduced appetite and weight loss, or increased cravings for food and weight gain, anxiety, agitation, or restlessness, slowed thinking, speaking, or body movements, feelings of worthlessness or guilt, trouble thinking, concentrating, making decisions, and remembering things, frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts, or suicide, unexplained physical symptoms such as back pain or headaches. For many people with depression, symptoms usually are severe enough to cause noticeable problems in day-to-day activities, such as work, school, social activities, or relationships with others. Depression symptoms in children and teens. Common signs and symptoms of depression in children and teenagers are similar to those of adults, but there can be some differences. In younger children, depression often presents with sadness, irritability, clinginess, worry, aches, pains, refusing to go to school, and being underweight. In teenagers, depression often presents with sadness, irritability, feeling negative and worthless, anger, poor performance or poor attendance at school, feeling misunderstood, extremely sensitive, using recreational drugs or alcohol, eating or sleeping too much, self-harm, loss of interest in normal activities, and avoidance of social interactions. Depression symptoms in older adults. Depression is not a normal part of growing older, and it should never be taken lightly. Unfortunately, depression often goes undiagnosed and untreated in older adults, and they may feel reluctant to seek help. Symptoms of depression may be different or less obvious in older adults, such as memory difficulties or personality changes, physical aches or pain, fatigue, loss of appetite, sleep problems, or loss of interest in sex, not caused by a medical condition or medication, often wanting to stay at home rather than going out to socialize or doing new things, or suicidal thinking or feelings. Risk factors. Depression often begins in the teens, 20s, or 30s, but it can happen at any age. More women than men are diagnosed with depression, but this may be due in part because women are more likely to seek treatment. Factors that seem to increase the risk of developing or triggering depression include certain personality traits, such as low self-esteem and being too dependent, self-critical, or pessimistic, traumatic or stressful events, such as physical or sexual abuse, the death or loss of a loved one, a difficult relationship or financial problems, genetics, blood relatives with a history of depression, bipolar disorder, alcoholism, or suicide, history of other mental health disorders such as anxiety disorder, eating disorders, or post-traumatic stress disorder, and then substance abuse, abuse of alcohol or recreational drugs, serious or chronic illnesses including cancer, stroke, chronic pain, or heart disease, and certain medications such as some high blood pressure medications or sleeping pills. Complications. Depression often gets worse if it isn't treated, resulting in emotional, behavioral, and health problems that can affect every area of life. Examples of complications associated with depression include excess weight or obesity, which can lead to heart disease and diabetes, pain or physical illness, alcohol or drug misuse, anxiety, panic disorder, or social phobias, family conflict, relationship difficulties, and work or school problems, social isolation, suicidal feelings, suicide attempts, or suicide, self-mutilation such as cutting, premature death from medical conditions. Prevention. There's no sure way to prevent depression. However, these strategies may help. Control stress. Take steps to control stress to increase your resilience and boost your self-esteem. Ask for help. Reach out to family and friends, especially in times of crisis, to help you weather rough spells. Early interventions. Get treatment at the earliest sign of a problem to help prevent depression from worsening. Long-term maintenance treatment. Consider getting long-term maintenance treatment to help prevent a relapse of symptoms. Diagnosis. Your doctor may determine a diagnosis of depression based on physical exam. Your doctor may do a physical exam and ask questions about your health. In some cases, depression may be linked to an underlying physical health problem. Lab tests, including a complete blood count or a thyroid test, can rule out any other possible causes. The psychiatric evaluation. Your mental health professional asks about your symptoms, thoughts, feelings, and behavior patterns. The DSM-5. Your mental health professional may use the criteria for depression listed in the Diagnostic and Statistical Manual of Mental Disorders. To be diagnosed with depressive disorder, a person must have experienced a depressive episode lasting longer than 2 weeks. Treatments. Although depressive disorder can be a devastating illness, it often responds to treatment. After an assessment rules out medical and other possible causes, a patient-centered treatment plan can include any or a combination of the following: psychotherapy, including cognitive behavioral therapy, family-focused therapy, and interpersonal therapy; medications, including antidepressants, mood stabilizers, and antipsychotic medications. Exercise can help with prevention and mild to moderate symptoms. Brain stimulation therapies can be tried if psychotherapy and/or medications are not effective. These include electroconvulsive therapy for depressive disorder with psychosis or repetitive transcranial magnetic stimulation for severe depression. There's light therapy, which uses a light box to expose a person to full spectrum light in an effort to regulate the hormone melatonin. And then alternative approaches, including acupuncture, meditation, faith, and nutrition, can be a part of a comprehensive treatment plan. References. Thank you, and please see the attached post-test and brochure that accompanies this video.